So this evening we have the privilege of having Dr. Neil Mullins with us. He is married to his wife Brenda, who is also with us this evening, and they live in Lowell, Arkansas. He practiced medicine, family medicine, for 45 years and is now an international health speaker with a passion to help people improve their health through diet and other natural means. He has presented health lectures in many countries, including the Ukraine, Bulgaria, Greece, Africa, Cuba, Argentina, Peru, Chile, Ecuador, and the islands. Galapagos. I'm not saying it. I'm slaughtering it. I'll let him say that when he comes up. Yeah. So he's also written books that I think we're currently out, but he does supply us with books, and I didn't think to ask you to bring them. But he's written several books, actually, and he can tell you about that as well, to help his patients with lifestyle disease. So please welcome Dr. Neil Mullins.
I'm not a big shot. We had a lot of fun, my wife and I, traveling, going to these different countries, and we had a guy that was interesting. He'd go ahead of us and get the hotel and clean place to stay and clean food, and so we had a lot of fun. And he passed away, sad to say, but I'm getting older too. And the other thing is the way the world treats Americans. I don't know, it's not quite as safe as it used to be traveling in different places, but we did have a lot of fun doing those things. Tonight we're going to talk a little bit about hypertension, and I want you to understand, like when you at home, you turn on the faucet and you get some water, has to be some pressure behind that, right? In order to get that to flow out to your glass. Well, it's the same way with your blood circulation. You got to have some pressure to keep the blood circulating, and we measure that in millimeters of mercury. I just brought my little cuff I have at home. We got one of these automatic things that you can take your blood pressure and it'll record it for you real easy. And so you all ought to get one. You can get one at Walmart or anywhere you want to, and keep track of your blood pressure. And we're going to spend a little bit of time talking about that. I think if something pops in your mind, you can interrupt me. I'm not real formal, and we'll try to answer. I don't know all the answers, but I'll try to give you what I do know about some of these things. I might mention, I'm going to read you first of all from some medical journals, and they're mentioning, does lifestyle really matter? And that's what we're going to talk about tonight a little bit. More than 1.3 billion people worldwide had high normal hypertension. And that is above 140/90. We're going to talk about numbers in just a minute. Between 1975 and 2015, the average blood pressure reading had stayed about the same for men and slightly decreased for women. And then we mentioned that despite health education and awareness efforts globally, only 57% of people with hypertension know their condition, and only 40.6% receive antihypertensive drug treatment, with 13.2% optimally controlled. It's quite interesting. I'm just giving this for a little introduction here, and then from the Cleveland Clinic, they give you a nice little journal you can get to come to your house every month if you're interested. And they mention about changes. You know, changes in medicine are inevitable. If we practiced medicine the way they did 100 years ago, they'd put me in jail. So there are changes. We keep trying to improve and find better things. And in November 2017, the American Heart Association and the American College of Cardiology released new guidelines that lower the threshold for hypertension. We're going to talk about that in just a minute. The data is overwhelming. It's very clear that the lower blood pressure for our blood vessels preserves our health and our cardiovascular system overall. According to the new recommendations, nearly half of all Americans now have high blood pressure. That's quite a bit, isn't it? But not all will receive medical care for that. And so I just want to mention that. And the last thing I want to mention in introduction here, Harvard's Men's Health, you can get that too if you're interested. And I have one from Tufts University, which I really like. They have a lot of good practical things. Here they mention again that they're lowering the numbers. Now, we used to always say 140 over 90, generally, that's hypertension. Now they're lowering that to 130 over 80. So that's interesting for us. Different if you're older, though. You can get away with having a little higher, okay? Here they mention the results found that targeting a systolic pressure of no more than 120 millimeters of mercury reduced the chance of heart attacks, heart failure, or stroke over a 3-year period. So remember that we give you two numbers. The highest number we call the systolic number, and the lower one the diastolic number. And so that's how much the pressure is. We're measuring the pressure of your circulation of your blood, and of course it makes a big difference. Now we'll mention this as we go along a little bit, but if you have a blood vessel like this size, okay, and you eat the wrong kind of stuff, and you put a bunch of junk in there, and crud I call it, there's cholesterol and fats and things, you have a blood vessel that's this size, right? Now, which is hardest for your blood to pump blood through, this one or this one? The big tube or the little tube? The little one's harder, right? All right, and so as the blood is heart is trying to pump blood through there, it's going to increase its pressure trying to get that blood through there. The other thing that's very interesting is that the little layer around there of muscle and things, that it can, by the pressure of the blood, can crack that and go out. For instance, if there's a little smooth muscle around there and it can make a big bulge, we call it an aneurysm. And if that breaks, of course, boy, you can just lose a lot of blood in a hurry. You usually die right on the spot. When I first started to practice medicine a few years ago, I had several people, I don't know why, that died of those aneurysms. I remember I went to make a house call, and they called me out to the house, and there's a nice little old man out there in this bib overalls, and I had to go inside, and his wife had fallen over in the tub. She had one of those aneurysms and busted it and died right on the spot. And they called me, and I had to go out and tell him that his wife was dead. That was one of the hardest things I ever had to do. Sweet little old man. So it's a real thing. And so we're concerned about living as long as we can, enjoying life as much as we can, and taking care of your blood pressure is going to help you a great deal. Now, the complications of hypertension. We have stroke. What happens with a stroke? You just plug up a blood vessel. You know, the left side of the brain pretty much takes care of the right side, and vice versa. If you plug up a little vessel here on the right side, that's where the people lose the use of their arm or their left leg. And so we don't want that. Congestive heart failure is another complication. Heart attack, same way with a heart attack, you just plug up a blood vessel. It's a pretty simple diagnosis. And what I always feel bad, when you read in the newspaper, some fella in 40s fell over dead. And most of those cases, there are some exceptions, but most of that is hypertension, and he's had a clot in his blood vessel. And what you feel bad about is preventable. So most of these things that I'm reading to you about complications are preventable by our lifestyle. And we call it atherosclerosis, putting those little plaques inside arteries instead of being like this side, like you said, it's this side. My own mother came to visit me. She was afraid of flying, didn't like to fly. And so I sent her a ticket, come visit me. And the night before she was to go back home to Arizona, took her out to a big restaurant. And I remember, I can still see, she set her fork down and fell over dead. I thought she just fainted, of course, me and my mom, and got a person looking here. My mother had plugged up her blood vessels and died right on the spot. It was a sad thing. So Mom was, I don't think diet was real good. We've been raised poor, and I don't know what she was eating, but anyway, that last meal is what did it for her, and she plugged up her blood vessel. So we want to prevent that, and most of that, not all, but most of that's preventable by your lifestyle. So we have kidney disease. Hypertension affects our kidneys. That affects the eye. People have macular degeneration, blood vessel rupture, and weakened memory and mental ability. Now, when you talk about the risk or your chances of having something happen to you like that, it goes up in proportion to the blood pressure. That's very interesting. Increased blood pressure and kidney failure, for instance. If you have blood pressure 140 over 90 to 159 over 99, you have 3 times greater chance of having kidney failure. If you have your blood pressure over 159 systolic, the top number, over 99, you have 6 to 22 times greater chance of having kidney failure. So it does make a difference for us. And if you lose your kidneys, you're going to die. Oftentimes you go to the hospital. I think one of the recent friends I visited in the hospital was unconscious, and they said, well, her kidneys have failed now. And I tell you this, it's usually a matter of hours, but sometimes they'll hang on for a day or two, surprise you. But they're going to die. We've got to have our kidneys, and if we lose a function of them, we're not going to make it. Now, what hypertension does, it affects those little nephrons, or little working particles in our kidneys that for the kidney function. And so that's what happens with high blood pressure. It ruins those little nephrons. Now, it's interesting that it also affects our mental ability. One study showed that 10 millimeters increase in systolic blood pressure, there's 9% increased risk of poor intellectual ability 25 years later. So why you say 25 years later? They do these studies for a long time, find out what's going on. So it's going to affect our mental ability too. Increase of blood pressure leads to increased what we call morbidity in general. Morbidity, just the words, means disease in general. Okay? So all the sicknesses and disease in general is going to be affected by blood pressure. Now, decreased blood pressure leads to decreased cardiovascular disease. For instance, just a 3 millimeter decrease in the systolic blood pressure, that's that top number, just 3 millimeters drop would yield 11% fewer strokes, 7% fewer coronary events, and 5% fewer deaths. Isn't that impressive? So you say you can make a big change. Some people don't like to make change. I can tell you, practicing medicine, people are interested, as you know, and some want to make changes or interested in making change. Others, they don't want to make a change, but just give me a pill and see if we can solve the problem. But it doesn't quite work that way. What we want to teach you is how natural things can help you. There are some problems by taking drugs. High blood pressure is controlled, causes a slow deterioration of the brain matter. If you're taking drugs. Less than half of those who take drugs to lower their blood pressure below 140 over 90, we find that it doesn't help everybody, but it helps many of them, and it's very expensive. I want to tell you an interesting experience. There's a place when a person gets into a crisis. As a doctor, I'd give them a drug to try and get that blood pressure down, and then try to get them on a different lifestyle and to change it. For instance, my own dad lived out in Arizona, and I gave him a prescription for some blood pressure medicine, high blood pressure. And that was the time I started jogging. I used to jog 5 miles a day. Can't do that anymore, but I used to, and love that. And so when I started jogging, my dad started walking. And as he kept walking, his blood pressure was coming down. And finally I told him to quit his medicine. He was able to quit his medicine just because of his walking. Isn't that interesting? And by changing his lifestyle. And he did not die of a stroke. We think he was 85, but we think he was a lot older than that. We weren't sure about his birth date. We don't know how old Daddy was, but he was at least 85 after that. So he lived a good life and walked, and he got Alzheimer's. It was interesting to me. He didn't know where he was, but he walked every day, and the cops would pick him up 5 miles from home. They'd take him home. They knew who he was. They'd pick him up and drive him home. But he walked until he died, and I thought that was interesting. His blood pressure was normal. Okay, came down to normal. It was off his medicine. So that's the goal that we want to work with you. Now, some people come in. I've had some patients that have blood pressure 220, 240 systolic. Can you imagine that? Over 110, 15, and I tell you, that's when you better do something drastic. I'll give them a pill, try to do something drastic, get it down, then try to change their lifestyle. But I'm thinking of one patient whose husband, with no medical training, he was manipulating her medicine and didn't think she ought to take medicine, and then he'd drop off her medicine, wouldn't give her medicine, and it was sad that she died of a stroke. And so blood pressure, like you say, can kill us, but if you do something about it, you can lower it and change and live a lot longer. Now, increase by diet and obesity. Obese men have a 4.6% increased risk of hypertension. I might mention exercise. I wasn't planning to spend a lot of time on exercise tonight. I go to Senior Citizens Wellness Center in Rogers, and when I get done exercising and take my blood pressure, it's amazing how much lower my blood pressure is. I wait about 7 minutes. I mean, you first get done, you have your blood pressure up a little bit. You sit down and relax a little bit, take your blood pressure, it's lower. Blood pressure really does lower, and they've got in that place 2 machines that people check their blood pressure after they're exercising. So exercise definitely will help you. Now, there was a study that showed a large blood pressure reduction with just lifestyle changes. Now, people, we live in a fast age in America. They want a magic pill, as you know. But there's not magic pills, but there's a place for them. But I want to say, if we could get a person to change how he's living, how he's eating, and how he's exercising, I tell you, make drastic changes. So they did a study with lifestyle changes, and this study only was for 3 weeks, and look what happened. The lifestyle changes, they had them drink no alcohol, no tobacco, no coffee, total vegetarian diet, and aerobic exercises. And in just 3 weeks, the average blood pressure at the start was 150 over 81, but at the end it was average 129 over 78 in just 3 weeks. And someone said, well, how can a vegetarian diet have to do it? Well, what happens? Less atherosclerosis on a vegetarian diet and less fat. And so it made a drastic change. So all of you, the best way is to make changes slowly and get on a goal and work towards it. And that's what Dane is here to help you do that. People, everything want quick things, quick fixes. But you get on a proper diet and proper exercise program, drastic things will happen to you. Now let's take a look at some of the dietary things that reduce blood pressure. And probably one of the most significant is salt. So I'll talk a little bit about salt. You know, societies, you go in the world, as we did, travel around different places, or Africa and different places where they don't eat any salt, they don't have any blood pressure problem. So it's interesting. You go to these villages and you check them out, and they don't have any blood pressure problem, and they don't eat any salt. I used to do this, and some of you had this. When I get my food there, before I would even taste it, I would take the salt shaker and go like that. Okay, it's a habit. But I've learned to quit that, and it makes a dramatic change. So societies that ingest little or no salt have no hypertension. When a diet very low in salt, like a rice diet or a fruit diet, they do not have a problem with hypertension. And if those people that eat that way, if they've been eating a different way, the blood pressure will fall down to normal. So changing the diet with only a moderately low change is not going to make it. You have to make a drastic change in regard to salt. Now let me tell you something. I have hypertension, but I tell you, I've made these changes, and it makes a drastic change. You can have a normal blood pressure. But at first, you will not like the taste of food. Food tastes without salt. And it doesn't take a week. It takes a few months, I want to just tell you. It's going to take 2 or 3 months before you enjoy the food. But I can eat a tomato without putting salt on it and enjoy it. But I didn't think I'd ever see that day. So just know that when you make a drastic change, you won't like the taste at first, but you will adapt to it and you'll enjoy the taste of food. So but it won't happen overnight. At least it didn't for me, I'll tell you that. It took a while. So reducing salt definitely reduces blood pressure. Now they did another study with 20 patients with an average blood pressure of 161 over 101. They reduced the salt for 1 year. I can tell you this, that the change would be a lot earlier in the year. But they did this study for a year. And at the end of the year, after 1 year, the average systolic, the top number, blood pressure was lowered by 19 points, and the diastolic by 14 points. Just dropping off salt. Isn't that interesting? And 16 of the 20 patients were well controlled solamente by, I was going to speak Spanish, forgive me, but only by reducing the salt intake. Okay. Now, low sodium diet reduces the risk of hypertension and its complications, as I've been telling you. It reduces the risk of a heart attack, complications of congestive heart failure, cirrhosis of the liver, kidney failure, stomach and nasopharyngeal cancer. All are affected, can you believe that, by blood pressure, osteoporosis, and kidney stones. Now let's have a little fun. I'm going to pose some things to you, and in your mind, you figure out what has more salt. Now, what has more salt? A couple corn chips or a couple corn flakes, okay? I'll talk to you in a minute about that. How about a fourth cup of peanuts versus 1 can of tomato soup? How about a third cup of sauerkraut versus egg McMuffin? How about a small bag of potato chips? How much salt's in that compared to instant mashed potatoes? How about cured ham, 3 ounces, versus Chinese rice, okay, 1 cup? How about French fries, 1 serving, versus dill pickle, 1 large dill pickle? How about frozen peas, a half a cup, versus peas canned, a half a cup? How about 2 slices of bacon versus a Danish pastry? Or 1 cup of buttermilk, or 1 cup of cottage cheese, okay? Now you have in your mind which one has more salt. Corn chips, 1 cup has 163 milligrams of sodium. Corn flakes have 217. 1/4 cup of peanuts has 155 milligrams of sodium. Tomato soup, a can, has 932. I want to tell you, I learned this. Soups have a lot of salt. Okay, sauerkraut, 428. Egg McMuffin, 821 milligrams. Okay, potato chips, 1 small bag, 168 milligrams of sodium. Instant mashed potatoes, 491. That's a surprise, isn't it? So I just want you to see where our salt's coming from. Cured ham, 3 ounces, 1,080. Chinese rice, 2,700. You know what it's from? The soy sauce. Soy sauce is really high. We were eating in a restaurant that had all these nice vegetables and things, and man, I checked my blood pressure. It affected my blood pressure some that soon. And so I got thinking soy sauce. So next time after I said, would you give me those vegetables, but don't put a bunch of soy sauce on it. And they did. Made a big difference. Big difference. French fries, 123 milligrams. Ice cream, soft serve, 220. Buttermilk, 1 cup, 257 milligrams of sodium. Cottage cheese, a cup, 850. That was a surprise to me. It was a surprise. So I just want you to know that you need to read labels, okay, and get smart. The average American diet, as you know, we consume about 4,000 milligrams of sodium a day. If you're healthy and you got normal blood pressure, you're probably consuming about 2,400, and you need about 250 milligrams of sodium. That's all you need. So it's interesting. You know, in America, we overdo everything, you know. So then give you a little glass of a juice, they have the mega size, you know. So we got mega size and everything. The other interesting thing, let's mention just a few things so you remember. The soy sauce I mentioned is really high, well over 1,300 milligrams, and just a tablespoon of soy sauce. Dill pickle, large one, 1,928 milligrams of sodium. Can you believe that? It's interesting. So we need to watch what we're eating. 1 slice of bologna has like 369 milligrams of sodium in it. And cured ham, 3 ounces, has 1,080. Hot dogs, 1 hot dog has 495 to 627 milligrams of sodium. And pretzels, 10 thin pretzels, 100 to 200. And canned soup, cream, mushroom, 1,039 milligrams of sodium. Woo! And vegetarian vegetable soup has 838 milligrams. And spaghetti sauce, a half a cup, has 992 milligrams of sodium. You wouldn't think that, would you? And the cottage cheese, as I mentioned, has over 500 milligrams of sodium. So low sodium is the goal that we want to work on. And like I said, it'll take several weeks or months for you to enjoy the taste of your food when you're used to putting a lot of salt on it, but you can change it. Now look at some of the food groups that have really low sodium. Fresh fruit in an average sodium serving is about 6 milligrams of salt. Grains and cereals, about 7 milligrams of salt. Unsalted nuts, about 3 milligrams of salt. Vegetables, 15 milligrams of salt. And shredded wheat, 1 ounce, 3 milligrams of salt. Isn't that something? So it makes a big difference. I laugh. I was at senior citizen place yesterday exercising, and the guy came up to me and he said, man, he said, I go here and I exercise, I do all these machine stuff. He said, I go out and he said, I really eat, he said. And he was talking about the price he paid. He can't get rid of his big stomach. But you know, if he would eat more fruit has a lot of good nutrition, but very few calories. That's what's so nice about that. People do not realize by changing your lifestyle of diet and exercise how dramatic it affects your health. Big change. All right, that's all. Thank you kindly.